Hi, my name is Justin. I'll be demonstrating the full abdominal assessment today. For this exam, I'll be inspecting the abdomen, auscultating, percussing, then palpating the abdomen, as well as evaluating the liver, spleen, kidneys, and bladder. So first things first, I'm going to go ahead and take a look at my patient, greet the patient. Hi, good afternoon. My name is Justin. I'll be your examinee for today. I'm just gonna do the abdomen exam. I am gonna go ahead and palpate your abdomen and stuff. If you feel uncomfortable, let me know, but is it okay if I begin?
Yes.
Awesome. So first things first, I'm just gonna note the patient's general appearance. She appears to be relaxed, alert, and oriented. No acute distress. Skin tone is appropriate for ethnicity. No signs of jaundice or cyanosis or pallor. So now what I'm going to do is I'm going to go ahead and lift her shirt, examine the surface. We'll look for any scars, striae, pulsations, any bumps maybe, and then especially the skin color. Or we'll look for any rashes or masses. I'm going to go ahead and lift your shirt just a little bit, okay? And then I'm going to pull these down just a little bit. Just to your waistline. So looking at the abdomen, skin is contoured, abdomen is flat, no distension noted. The color's appropriate for her ethnicity. Her belly button is symmetrical. Everything's looking good there. The next thing I'm going to do is I'm going to auscultate. Now the reason why I'm going to auscultate is because if we start with percussion, palpation, you're going to get the bell started a little bit on the hyperactive side. So we want to hear it first. So I'm going to go ahead and hear with the diaphragm of the stethoscope, which is going to be the bigger part. I'll make sure that that's turned. And then I'll start on the right lower quadrant of the patient. It might be a little bit cold. Did you eat something before this?
I did.
Yeah? So, bell sounds are normal active. I was able to hear them pretty quick, within 5 to 10 seconds. No abnormal sounds. They're a little bit on the hyperactive side, but it could just be because the patient just ate. The next thing I'm going to do is I'm going to go ahead and percuss. Just light percussion across. Again, starting at the right lower quadrant, and I'll make my way right upper quadrant and move all the way around, kind of like a circle. What I'm looking for is tympanic all the way around. But if we hear any dullness, we might be where an organ is. But it could also be due to intestinal blockage or masses. But we'll go ahead and the sounds are tympanic all the way around. No abnormal findings. The next thing that I'm going to do is I'm going to go ahead and do a little bit of light palpation. The light palpation is going to be to check for any tenderness, masses, and guarding from the patient. So you let me know if you have any pain, but I'm going to start off super light. Okay, we'll start at the same place, and I just kind of feel really quick around. Are you ticklish? Sorry.
It's fine.
So, no masses, no superficial masses at least, and the patient didn't really guard. The patient's just a little bit ticklish. The next thing we're gonna do is deep palpation. Now, deep palpation is when we're gonna go ahead and look for any deep masses, any tenderness, and we might be able to feel some organs if there's organ enlargement, so like a large liver or a splenomegaly. So we'll go ahead and do that. I'm sorry, this one's gonna be just a tad deeper. Okay. Everything was fine there. There was no noted masses or abnormal findings there. The next thing I'm going to do is a peritonitis check. Now, obviously with this patient, there's no peritonitis visible because the patient has a flat stomach. But with peritonitis, they're going to have this like board-like abdomen. The abdomen's going to be very distended and very rigid. So the best way to kind of check this is to put your hand in. I'm just going to deep palpate really quick. And as I deep palpate, I'm going to release like pretty quickly, and there will be like pain for this. But was there any pain or anything?
No.
Since there was no pain, I mean, there was no noted peritonitis, so we'll go ahead and move on from there. The next thing I'm going to do is I'm going to do the liver assessment. So I'm going to go ahead and estimate where the liver is. By doing so, I'm going to follow right in the middle of her, the mid-clavicular line. So I'm going to start mid-clavicular on the right side. And what I'm going to do is I'm going to start at an area that's tympanic. And then I'm gonna go ahead and move upward, which will, once it starts to get like to a dull sound, is where I'll be able to kind of find the liver. I'm sorry, okay.
Mm-hmm.
Just gonna move it up. Okay, so percussing, I'm gonna kind of estimate that her liver span was approximately maybe 6 to 10 centimeters, which is typically around that normal range. The next thing I'm gonna do is liver palpation. In the same area, I'm just gonna go below the costal margin, and I'm gonna palpate like the liver's edge. As the patient breathes in, that way maybe I might be able to feel the liver. Sometimes you can, sometimes you can't. But we'll check for any like smoothness, softness, and tenderness, always. So what I'm gonna do, I'm gonna kind of deep palpate the same way, but I'm gonna ask you to kind of take a breath in, and then breathe out if you need to. And then we'll do it again. Go for it. Take a deep breath in. Sorry. Does that hurt?
No,
No? I was able to feel the liver ever so slightly, and it was smooth. I didn't feel anything abnormal and non-tender, just a little bit of tickling. The next one's going to be the spleen assessment. So the spleen assessment is going to be on the other side. I'm going to use Trebus base, which is going to be in the left lower anterior chest wall, which is going to be right under here, for any signs of splenomegaly. Now it's important to understand that here, in a normal average adult, you're probably not going to be able to palpate the spleen. You won't really be able to palpate them. You'll be able to palpate it in like a malnourished adult. So I'll start with percussion before I actually palpate the spleen. The percussion is gonna, again, we'll start somewhere tympanic and we'll move to a place where it's kind of like duller. Okay. Now I'm gonna go ahead and palpate for the spleen. I know it's in this area. Sorry, I'm gonna just look for your ribs really quick. I'm gonna go under the ribs, okay? And I'm gonna go ahead and palpate for it right under here. You're gonna feel a little bit of pressure, okay? Take a deep breath. This one tickle. Sorry. What I'm gonna ask you to do actually, can I actually ask you to kind of turn to your side like this? And then just kind of move this forward. So this might actually allow me to palpate the spleen here. Go ahead and take a deep breath. Sorry. So I was not able to feel the spleen. You can go back to normal. I was not able to feel an enlarged spleen, which is good. And then once again, typically you won't feel the spleen unless the person is malnourished. So non-palpable, and that's a normal sign. The next thing I'm gonna go ahead and do is do the kidneys and bladder. With this one, I'll go ahead and look for the end of her ribs on the back side, and I'm gonna go ahead and kind of use a little, kind of like a little hit. If there's any tenderness, that could indicate like kidney inflammation. So what I'll have you do is I'll kind of have you sit up. You can pull your shirt down too. So I'll have you sit up. And what I'm gonna do here, actually, that way the camera can see, let's have you like that, just like that. So right here, I'm gonna look for the costovertebral angle, which is kind of like where the ribs kind of do this number, yeah. Once I find it, I'll put my palm flat. Can you move up just a little bit? Right there. I'll put my palm flat, and I'm just gonna kind of hit. Any pain?
No.
Any pain? Okay. And then kind of look for it here. Any pain?
No.
Any pain? Okay, good. So no tenderness, so that means no CVA tenderness on either side. The last thing I'll do is the bladder percussion. I'll have you lay back down for that. Okay, this one I'll have you kind of pull down like your pants, just kind of under your belly button, just a little bit under. So right here is where the bladder is typically located. You kind of want to picture where you would typically do a bladder scan. Now, from assessment, when someone's bladder is distended, like you will see it when they're laying flat like this. In this case, there's no distension noted. So what I'll go ahead and do is I'll go ahead and kind of percuss and like palpate around the area, and ask if she has any tenderness. So here, any pain?
No.
Tenderness?
No.
So no noted distension, and no tenderness noted. You can put your shirt back down. Thank you so much. This does complete my abdominal exam. My patient tolerated the exam, and there were not really any abnormal findings. Thank you.